Lower high blood pressure, known your risks for high BP. Risk factors that can increase your risk of high blood pressure include health conditions, your lifestyle, and your family history. Some of the risk factors for high blood pressure cannot be controlled, such as your age or family history. But you can take steps to lower your risk by changing the factors you can control. Elevated blood pressure. Elevated blood pressure is blood pressure that is slightly higher than normal. High blood pressure usually develops over time. Having blood pressure that is slightly higher than normal increases your risk for developing chronic, or long-lasting, high blood pressure in the future. If your blood pressure is between 120/80ths of a millimeter of mercury and 129/80ths of a millimeter of mercury, you have elevated blood pressure. Diabetes. About 6 out of 10 of people who have diabetes also have high blood pressure. Diabetes causes sugars to build up in the blood and also increases the risk for heart disease. Unhealthy diet. A diet that is too high in sodium and too low in potassium puts you at risk for high blood pressure. Eating too much sodium, an element in table salt, increases blood pressure. Most of the sodium we eat comes from processed and restaurant foods. Not eating enough potassium external ion, a mineral that your body needs to work properly, also can increase blood pressure. Potassium is found in many foods. Bananas, potatoes, beans, and yogurt have high levels of potassium. Physical inactivity. Getting regular physical activity helps your heart and blood vessels stay strong and healthy, which may help lower your blood pressure. Regular physical activity can also help you keep a healthy weight, which may also help lower your blood pressure. Obesity. Having obesity is having excess body fat. Having obesity or overweight also means your heart must work harder to pump blood and oxygen around your body. Over time, this can add stress to your heart and blood vessels. Too much alcohol. Drinking too much alcohol can raise your blood pressure. Women should have no more than 1 drink a day. Men should have no more than 2 drinks a day. Tobacco use. Tobacco use increases your risk for high blood pressure. Smoking can damage the heart and blood vessels. Nicotine raises blood pressure, and breathing in carbon monoxide, which is produced from smoking tobacco, reduces the amount of oxygen that your blood can carry. What other factors increase my risk for high blood pressure? Family members share genes, behaviors, lifestyles, and environments that can influence their health and their risk for disease. High blood pressure can run in a family, and your risk for high blood pressure can increase based on your age and your race or ethnicity. Genetics and family history. When members of a family pass traits from one generation to another through genes, that process is called heredity. Genes likely play some role in high blood pressure, heart disease, and other related conditions. However, it is also likely that people with a family history of high blood pressure share common environments and other potential factors that increase their risk. Family health history is a record of the diseases and health conditions people in your family have had. Family health history is a useful tool for understanding health risks and preventing disease. Other characteristics. Both men and women can have high blood pressure. Some other characteristics that you cannot control, such as your age, race, or ethnicity, can affect your risk for high blood pressure. 1. Age. Because your blood pressure tends to rise as you get older, your risk for high blood pressure increases with age. About 9 out of 10 Americans will develop high blood pressure during their lifetime. 2. Sex: women are about as likely as men to develop high blood pressure at some point during their lives. 3. Race or ethnicity. Black people develop high blood pressure more often than white people, Hispanics, Asians, Pacific Islanders, American Indians, or Alaska Natives do. Compared with white people, black people also develop high blood pressure earlier in life. How to lower your blood pressure. Is there any natural way to help people to lower high BP? Yes. You can reduce your high blood pressure without medications, strenuous exercises or diet changes. It's the easiest and all-natural way for your choice. Please click the link here to access the program, https://highbloodpressure.healyourpain247.com.